So now,
I
yes,
have a question.
it has to be easy though, yeah.
Well, they're all easy for some. The ugly one that you just showed, would that mean you can get pregnant?
They can get pregnant, yes. Yes. There's a lot of those mares that get pregnant, but you have to make sure that that uterus is clean, it's healthy, there's no bacteria, that the mare ends up being, treated properly for that. And then those mares are the ones that you end up putting on Regulate, because you want to stimulate the growth of those glands and things like that, during the pregnancy. So let's talk a little bit about, this kind of stuff, which is another thing that I think sometimes we forget. We get, 14-day pregnancy, but we often forget that, this bear is going to have 11 months between that first check and the delivery of the foal. And those mares could have problems such as early embryonic death. They could have metabolic or endocrine problems, or they could have musculoskeletal conditions or prepartum conditions or postpartum conditions that will affect either them carrying the foal to term or them, faring out okay during the foaling and postpartum time. So early embryonic death, this is something that, a lot of people say, well, the mare was pregnant and she lost the pregnancy. Oh yeah, she was probably never pregnant anyways. I had somebody the other day tell me that, there's a lot of mares that we check that end up losing the pregnancy. Well, the more mares we do, obviously the higher the percentage of mares that are going to lose the pregnancy in our hands. Not that the percentage is higher, but if we look at 100 mares and pregnancy loss is 10 or 15%, well, 15 of those are going to lose the pregnancy. Compared to somebody that only breeds 2 mares, probably not going to happen. So, anyways, why does early embryonic death happen? Well, it happens because of oocyte age. The oocyte is the egg that is inside that follicle. This is the egg, unfertilized egg. And a 20-year-old mare has 20-year-old eggs. It doesn't matter how you look at it, the age of those eggs is going to age with the rest of the mare. It's not like the ovaries are there, they still cycle, they still have all this kind of stuff. Those mares don't go through menopause, but the quality of those oocytes is reduced. And most of the time is because the DNA of those eggs is not as good. It has DNA aging issues. Then we have oviductal environment, uterine environment, or we have, endocrine, which is hormonal problems, constant stress, pain, and environment. 50% of the pregnancy loss occurs in young fertile mares, without any real good explanation. There's a higher incidence of pregnancy loss in mares older than 14 years of age. And about 60% of detected pregnancy loss occurs during the first 45 days of pregnancy. Mare problems, well, we have also not only embryo problems, but mare problems, ovary, progesterone deficiency, uterine problems, infections and scarring. Somebody fell asleep because they dropped it. Embryo problems, size, inadequate size for the gestational age, or genetic or chromosomes. Now look at this. This is a 30-day-old embryo. And this embryo here, this is the foal. This is all the blood vessels inside that little pregnancy. And you can see that this one here is a 21-day-old pregnancy. This is the first time this little blue spot that comes in and out of focus here, right there. That's the heartbeat of that baby. And you can see that, a week later, 28 days later, you can see that it is a lot more evident, a lot clearer, a lot easier to find. But if we go and look at this kind of situation, this is the 28 days, the mare is still pregnant, but it's got a dead embryo. There's no heartbeat. So, there's something that didn't go wrong, didn't go right in this pregnancy. and we can detect it with the ultrasound. Not only because there's no heartbeat, but it's irregular, it's smaller, it's not right for the time of gestation, etc., etc. Now, the other thing that happens with some of them is that we might have chromosomal problems, parental abnormality because of the stallion, or because of the mare, because she's old, or because she got mated too late. Aged gametes, which means aged eggs or aged sperm, will have DNA denaturation, and what happens is that DNA is unable to sustain the pregnancy. Also, we could have problems during early development, such as environment of the oviduct or manipulation, because of freezing or some of the techniques that I'm going to show you here in a second. Now, this is a karyotype of a mare. And as you know, horses have 64 chromosomes. There's 32 pairs. So there's 31 pairs here, and then there is, 2 sex chromosomes, XX or XY. Well, if you look at all these pairs of chromosomes here, you see that most of these chromosomes are pretty similar in size, except 2 of them. Can you see which ones are? Number 1 and number 21. Exactly. So those 2, what happened here is that there is one piece of this chromosome here that got translocated or moved to down here. And that is enough for that embryo to not be able to do the cellular division that it needs to do in order to maintain a pregnancy. So sometimes, because the mare got bred too late, or sometimes because it's just the genetic combination of the 2, it doesn't work. So, we have to keep those things in mind as well. So, what do we do in some of these cases where we have, a mare that has a bad uterus, or maybe it's a competition mare? We say, well, she's going to be a donor mare. We're going to do an embryo transfer on her, and that's something that we're doing more and more, in recent years. So, here's, we have a bad uterus or a mare that just just needs to be out competing all the time. So we breed this mare, and then we end up with this little baby there. And about 7 days later, we already had a number of mares that we had organized so they would cycle at the same time as this one. And then, we have a nice suburb uterus for this little embryo. And then at 7 or 8 days, that baby goes from there to here. Easy. Simple as pie. So, and then this baby will grow inside this uterus, without any major risks for you. Now, the other thing that, we have, we're going to start doing now is, this genetic testing. As you know, that in quarter horses, there are a number of genetic diseases that have developed, or that they have been transmitted from certain lines of horses. We have HERDA, which has HYPP, this glucose branching enzyme deficiency, PPSM, or also we can use it, use these techniques to, determine the gender at the same time. So look what happened here. This is, a mare. We can take samples from this baby in 2 different ways. We can do it through an amniocentesis, and you can see here's the needle coming in and trying to aspirate some of that fluid, to harvest some cells. Or we can do this. Let's see if this one's going to work. This is a video that I was given by Dr. Young Ho. He's a colleague at Texas A&M University, and you can see that, this is a 7-day-old baby that, is being, handled with a micromanipulator. They're taking the cells out of that, very, very few number of cells. And then once those cells are taken out, then they are transferred into clean media, and this is the size of the sample that you end up with. And that sample, what happens with it is you go and basically extract the DNA from that. And this DNA obviously is already the combination of stallion and mare. So you have the DNA here, and somebody was asking me yesterday or the day before, is it, oh, is this dangerous? You know, could you have a foal with one eye, or, you know, maybe, you know, you suck out one leg or something? No. These cells are almost like stem cells. And those stem cells are pluripotent. So, you know, they can, you know, you can develop an embryo out of one of these cells, if you will. So what happens is they extract the DNA and they put it through a process called polymerase chain reaction, which is PCR. And then, you know, once the, you know, the whole process goes through, then they run a gel. And, you know, this gel, there's all these little bands here. And depending on the presence or absence of certain bands, then you can tell if, you know, that horse had, you know, G-bed, or it had hernia, or it had, you know, or it had an X chromosome or a Y chromosome, depending on what you test. So this is something that, you know, we're going to start doing here with some of our clients that, you know, have requested that service. Now, the other thing that I wanted to talk in the last 5 minutes or so is that I want to talk about horses and humans, you know, in North America have developed some sort of similar habits. And I was here last week listening to Dr. Payton, and Dr. Payton said, you know, he had been in Africa working with some horses there. And those horses were fit as, you know, just incredibly fit. There was not an ounce of fat in those horses. They were doing well. They were, you know, not neglected, but, you know, very, very fit horses. Well, that is not the case in our horses here in North America. You know, our horses in North America now stand, for the most part, in a stall. They get fed, you know, way over, you know, the amount that they need to live. And as in humans, what happens when you end up developing very bad eating habits as a human? Well, most of the time, you end up with this deal called type 2 diabetes, which is cardiovascular problems, glucose intolerance, insulin resistance, visceral adiposity, which is, you know, this fat that, you know, I used to have, lipid disturbances, you know, hypertension, atherosclerosis, etc., etc. And these things are not, you cannot send those to Dr. Cruz to operate on. They're not surgical issues. You cannot operate type 2 diabetes. You have to deal with diet. That's what the doctor says. You have to change your eating habits. You have to exercise more. You have to do all this kind of stuff. Well, the same thing happens in horses. There's just a little bit of a difference thing in some horses because, you know, we call it equine metabolic syndrome, or, you know, PPID, or whatever you want to call it. You know, there's a little disagreement in terminology, but, you know, these are mares that, or horses that are easy keepers and have regional fat deposits. And most of them are either Pasofinos or Andalusians or Arabs, Morgans, and sport horses. Very, very, you know, prevalent in those breeds. And look what happens. So, you know, just another question before we finish. Easy keeper mares have hormonal problems that primarily affect their breeding ability. Is it true or is it false? You know, I have to look at it from my prism. You know, breeding stuff is my gig. So, what do you think? So those fat mares, do they, you know, primarily are affected in their ability to breed? Yes or no? 51. Okay, now I'm going to turn the timer on and see if we can beat 60. 60 is the number to beat. Nothing. Darn it. Okay? So, true. False. It does affect the breeding ability, but it's not primarily the breeding ability. And why does that happen? Well, it happens because, you can see the effects of metabolic